So hello everyone, I am Dr. Avinash Chauhan, Senior Resident Doctor, Shivaya Hospital, and a specialist in Ayurveda, spine and joint related disorder. Today I am sharing very interesting story of a vascular necrosis. Patient name is 𝒉𝒂𝒂𝒔𝒉 from Goa. Right now, first of all, I am sharing the MRI changes, and before that I am going to tell you something about the patient condition and the results after treatment. So I will ask to the patient directly. So first of all, Vikas, just tell me the recent condition, and when you just diagnosed with the vascular necrosis at the first time, so at that time what is the situation, what you was suffering?
My doctor first, it was I was having pain in the month of August, that's 2021.
Okay.
So I was having a little kind of a pain, like as though I just slipped or something. So then I started using different kind of medicine like tube, then warm water and all those things. But
just like a normal person,
yeah, exactly. So I visited my physician, so he prescribed me some medicines. Did not get all right. I changed the prescription twice. Did not get okay. Then he suggested me to go for an MRI straight. So I went for an MRI, and then the doctor told me that's on November.
Okay.
So the report came saying that it's an AVN.
Alright.
So
what was the situation at that time when you just get that pain?
Totally, actually, I was collapsed, like the way doctor told me that I need to go under operation for total wall replacement. But before he said I need to do the core decompression. That was a temporary relief, because I asked doctor, would it cure my disease? So he said, I cannot assure you, but it does not cure, but it will only give you a temporary relief, which may work up to a year.
Alright.
And then you have to compulsory go for the wall replacement.
Alright.
So I was like,
means each and every treatment when means like core decompression cancer, just give you the temporary relief.
yes, just a temporary.
As per doctor's suggestion.
Yes, because I asked him that would it solve the problem. He said no, it will not solve the problem. It may solve or it may not solve, but we have not seen in the history of science that it will solve the problem.
Alright.
So it's just a temporary relief, just to so that the wall does not get worn faster.
Alright. So how did you know about that means our hospital and our treatment?
Actually, I was totally in depression, so I said let's just Google and see. We Google a lot of things. So I came across your video. That is the first video I seen of yours.
Right.
So I called you. I think I called you. We had a telephonic conversation, so you told me like this thing can be cured. But I was having a lot of doubts in my mind. Like the science says it's not. There's no chances. So I said like how it's possible over here.
So how difficult to from Goa to Uttar Pradesh now for treatment purpose? So how difficult it was?
Not really difficult, but the journey was quite a lot. Like it's almost like 2,000 kilometers.
Yeah, we can suggest, but the decision you have to take, just go for the treatment because it is not. I can understand because you're from Goa. If you want to take treatment in Unnao,
Right.
and just going towards the Ayurveda.
Yeah.
So what is the main reason you just suggested and you just select our hospital?
Because I did not find any, to tell you doctor sincerely, I did not find any, I don't know what exactly happened, but I did not find a genuine videos kind of. Like either it was cutted, it was not like a complete video, or the best thing I liked about your video is you should not say like you come to my hospital and you will get recovered within 6 months. That's one thing I noted of yours. And there were a lot of other comments. There was not even single comment about a patient which was negative.
Correct.
Like I did not get healed, or something was wrong, or things became worse. There was no negative. So these are the only two things like more pull towards your hospital.
Alright. So right now I want to share something about the MRI because it is very interesting. So everybody has to see, because if you are suffering from a vascular necrosis, you have to see the results. First MRI I want to show you, that is 17/11/2021. That was the first MRI when the patient gets to know about the vascular necrosis, that is second stage of vascular necrosis. And you can see the one more thing, that is extensive marrow edema seen in the entire right head or neck with the right mild joint effusion. It is showing in the MRI. Second one, that is you can see 25%, that is a necrosis area, 15 to 20%, that is second one in the left femoral head. So overall that is 25% damage in the necrosis area, and second in the left hip, that is 15 to 20%. So that is ball is just getting to collapse in that situation. That was the first MRI when the patient know about the avascular necrosis at that time. It was second stage, and patient came to my hospital at after 2 or 3 months of this MRI. So that was the time of February. So that is the second MRI. I want to show you the results. You can see 21/4/2022. Now you can see, firstly you just saw that 15 to 20% in the first MRI and 25% right now. It is just going back to his 5%, means 20% is totally reduced in the femoral head. And one more thing I want to show you, because that is the MRI report. So I want to show you the MRI film. That is the first 17th November 2021. That is the first MRI report, MRI film. You can see the necrosis area. One second. This one. You can see the necrosis area, this part. And one more thing I want to show you, that is, you can see that is upper part, that is the lower part. And again, if I want to show you some, again that is a new MRI, 21st April 2022. That is after my treatment, so you can see the results. It is totally disappeared from the upper side. So almost 20% is reduced. Necrosis is reduced up to the 20%. Only 5% is remaining in the MRI film also. So that is the result of our treatment after 2 or 3 months. So ៌𝒌𝒊𝒏𝒂𝒔𝒉, first of all, just tell me about when you came to my hospital first time.
I came in the month of Feb.
So at that time, what was the situation? What was the condition of yours?
I was limping a lot. I could not walk, and in case even if I sit, to stand it was very difficult. And once I stand up, I had to wait for a minute and then walk.
Alright. So that was the situation when you, because I think at that time you were suffering from lots of restricted movement also.
Yes.
And one more thing I think that is it also restricted to your future and for your work also, I think. So at that time, what was your thought about the avascular, it will cure or not when you came to my hospital? What was thinking at that time?
That time I had faith actually, because the first important thing what you always tell all your patients is to have faith in your own self.
Correct.
You should have the positiveness. So I strictly believe if you are not positive, nothing is going to work. Either it's in medical field or anything,
Any other
job.
Correct, you're right.
So I believe it's because I see patient over here. When I came over here for the exercise, I used to ask people like, I mean, you can tell me anything. You can bluff me also with everything. Because I personally asked patients how they were feeling. There was also patients who was having a second treatment. I got a very good feedback. So I became more positive on that.
So that means when you came to my hospital, when you reached here, you just asked to the patient over here who was admitted to my hospital.
Correct.
So they are just giving to the positive.
All were positive. There was not even one negative. So
means what was the treatment? Means after 7 to 8 days, what you get from this hospital?
A lot of benefits as such, like the leg. If you cannot stretch the leg, the movements become very flexible.
Okay.
And I mean, like there are a lot of benefits which you can feel from within yourself.
Correct. Because if you are patient of AVM, so you can feel yourself.
Exactly.
Correct. So and one more thing, I think every patient are just curious about that thing, that is medication. If at that time I was using any medications of yours treatment during
No,
treatment?
none of the medications.
There is no treatment, medication for.
Nothing.
Okay. So because that is very curious question.
Yeah.
And if a patient just asking about that, sir, you are giving any painkillers?
No injection, no painkillers, no cuts, no settings, as specified by any of your videos.
Yeah, correct. I think you watched all the videos, lots of videos.
Yeah, lot of videos. Yes.
So after that, when you discharged at a time, so what you feel after the discharge time, means last 2 months, what you feel?
A huge improvement. I can say almost within myself, I can feel I'm 80% cured. Though the MRI says that I've been cured up to certain percentage, but I'm feeling a huge improvement.
Because that is the doctor's part, it is MRI change. And because I'm just personally asking to you, because you are the patient, you have to change your movements if you don't have any results in the movement. So you will feel, sir, there is no results. Because movement is the main thing. Patient want to just relax from the pain, from movements, because if they don't have any results, in the MRI it is showing that is my part. If you don't have any results, means with the pain, with the restricted movement, so you will feel, sir, there is no results. So just tell me your personal experience about the movements and the pain also.
Movements, doctor, I can say like when I came first time, I came with my cousin brother. Because it was unknown place, and secondly I could not walk also. So every time I used to hire this thing to travel, maybe
support.
Just like a support. And even from the room coming down, I used to come with him. And hardly I used to come. Maybe in a day, like I used to just come once or twice down. So because I used to get a lot of pain. And now for this second visit, I have not bought it because I'm confident about myself. And the best part is like I am coming 3-4 times down. I'm just walking a little bit outside just to.
Now I can understand.
So you can just imagine how much I'm flexible now and how better I'm feeling.
I think nobody will tell you you are suffering from.
Exactly.
So that is a very, I think, that is also a motivating part.
Exactly.
For the patient perspective also, because if somebody is telling what you are limping, so just it will create some demotivating, some disappointment in the mind, because I am just taking treatment, I am just limping right now. So what is the results? And in the MRI it is showing, that is another part. That is for me, for the patients also. Okay, so just tell me about the right now what you are about the movement. You are just free from that thing or not?
Yeah, I'm totally, I'm feeling very flexible.
So can you show me some movement?
Before it was like, in case if I would stand, I would to just relax my muscles and then wait for a minute and then walk like limping. Like I used to limp like this and walk. And
I remember
that. Because even when I was traveling on the airport, I had hired a boogie on the Delhi airport. So I could not walk. So even now, if I just sit, even in the flight, I was having a tough problem because after sitting for 2 hours, I could not walk. So I was having tough time. So now even if I sit and just, I can directly walk. I don't know if I'm limping a little bit, but
I think you can walk fastly, you can walk easily or not?
Yes. Totally perfectly. And even I could not stand on this leg is because of stress, and now even I can stand on this leg. So especially while changing the clothes, and I could not. I used to take the wall support.
So now you can climb the stairs or not?
No, doctor. I'm still facing problems.
Some issues.
Yeah.
Okay.
Climbing stairs.
So right now means during walking.
Walking absolutely no issues.
So means sitting position and all these things are feeling better.
Yeah. Before I used to face all these problems while walking, sweeping, standing, everything. But now with those things, apart from staircase.
All right.
Yeah.
So that is the condition of patient who is suffering from AVN second stage with 25% necrosis area. Right now, he just back to his 5%. That means almost 90-95% is totally recovered. In the MRI changes that it is showing, and the patient perspective, it is feeling very good. And the restricted movement was totally disappear. And after 2 months of treatment, he's feeling better. At that time, he was feeling very nice for treatment. So just tell me about the medications. If you are just skipping that medications, you have pain or not? So that is a big part. Patients are asking, sir, if the medication I am taking, so result will come, pain will reduce. If I am skipping, pain is increasing. So that is the thing or what?
Normally it's not only about the medication. As you said, doctor, because I did it practically. See, these things are not easy. I would say these things are not easy. It's not a one-day job. Like you once you get out from here, you just take the medicines and you get all right.
Correct.
So it's a long process, as you say. Like there are a lot of hard works. Like you have to follow your diets on time, your schedules on time. You have to be very systematic with things, and then that's how you see the results.
Means you have to be change your lifestyle also.
Exactly. Because we are leading a lot of wrong lifestyles, and we are skipping our food, meals, and a lot of things which leads to a lot of disturbance and imbalance in the body. So which you have guided us how to get these things.
That means patients have to do. They have to do in that area also. Because it is, I think it is the most important part of this treatment
Yes.
in avascular necrosis.
Especially the food.
Food also, correct, you are right. And what about the exercises part?
Yeah, exercise gives you a lot of relief because when I was having pain and when I had gone back with the first treatment, I was having pain, but yeah, I was feeling better. But once you start the exercise, it gives relief to your muscles. It's more flexible. There are a lot of movements.
So that is a story. So what message would you like to convey to the patient who is suffering from avascular necrosis? Because you are very young. So because you can understand the situation of the patient who's youth situation, because they have some recent, they don't know about the avascular necrosis, but they get MRI and just know about the AVM.
I would suggest actually all the patients that see, we all have a doubt, like on YouTube we have a lot of good videos, bad videos, negative, positive, lot of things, and we always have a doubt like going into some other state and like what would be our situation, either we are investing money in a lot of things, we have a question. But I would say you can blindly come to this hospital. As doctor says, it's totally done the way he explains in the video. I would not say everyone would recover fast, but it depends body to body.
Correct.
And how the way you take the treatment seriously. I would also suggest to patients like do not take this disease lightly, because a lot of people have a lot of things in the doubt, like okay, let's try this medicine, let's try that medicine, and the stage goes from second stage to third stage, third to fourth, and it's very difficult to get it in control. So that's my suggestion.
So one more thing, what about the hospitality and what about the staff? Is there any problem you face here or not?
No, absolutely not. Nothing. There's nothing to complain about. Everything is perfect. Everyone is down to earth over here. Everyone is every service is given over here.
So alright, so that was the story of 𝒂𝒑𝒑𝒐𝒊𝒏𝒂𝒂 from Goa. So that is very not easy in the young generation. For the young generation, it is not easy to accept that avascular necrosis, but he accepted and he fought with the avascular necrosis. Right now, he is just almost 90%, it's 95% is totally gone from, we can say it is totally gone. 5% is remaining, it will disappear with the time, because he is following very seriously, consciously and religiously everything. So definitely, if you will follow his instructions, not mine, if you are following the instruction of the patient, so definitely you will get the results. And thank you so much for watching us, and just you have to share the video to everyone who is suffering from avascular necrosis, especially young generation. Firstly, because we have to reduce the avian disease and skip the surgical procedure, because in young generation, if you are going towards the surgery, it is not good for your joint, for your future also. Thank you so much. Keep sharing that video to everyone and stay connected with us. Thank you so much.